This brief presentation will show how to register data into the clinical visit form in the Neurizon Neuromodulation Database. The clinical visit form is designed to register relevant data on the current status of a patient, both preoperatively, that would be baseline data, but also postoperatively, that would be follow-up data for as many visits as is needed for the patient. As with most forms in the database, the only mandatory field is the date, meaning that if there are fields where you don't have the information or for some reason do not want to supply the information, that is completely optional. You can register several types of visits, including both preoperative examinations, follow-up evaluations, or project visits, and that can be both outpatient visits, admitted patients, or simply a phone or email consultation. Common to all clinical visit registrations is the work status. That is divided into three parts. Two of them are drop-down menus. First of all is the patient fit for work, partially fit, or unfit for work. After that, what is the current work status of the patient? I will show the drop-down menu very shortly. And if the patient is indeed either working or studying, you can register how many working hours per week this patient is able to perform. Then, for each indication that you already registered for this patient in the clinical data form, those indications will have their own set of relevant variables. And finally, the current treatment status of a patient is divided into 2 or 5 parts, independent of the therapy. There are 2 or 5 parts for each therapy, but dependent on the current treatment status for each therapy. First, there is the status, and then second of all, there is the patient's expectation if it is before the start of a treatment, or the patient's evaluation if it is a follow-up visit in the patient global impression of change. If the patient is currently treated with a specific therapy, the physician can rate the outcome. The patient can note whether they would choose to have this therapy again, knowing what they know now, and also if the patient would recommend this therapy to his or her peers. There are a few other fields that can be registered in clinical visit, and I will demonstrate this now. First of all, go to New. That would be the same menu for all repeatable events. Go to Visit and Examination and click Clinical Visit or Examination. As for all forms, first register the date. Let us say that it is today. You can write here who evaluated the patient, and here you can choose the visit type. For most of them, the variable sets would be quite similar. The most notable exception is the preoperative examination. Here you would note if you have informed consent from the patient and also the smoking status of the patient in this short drop-down menu. Here you can list which procedure it is that you are planning in this visit if it is a preoperative examination. And the most notable here is the implantation of an intrathecal drug delivery catheter. You can write here what the main indication is for your planned procedure. Let us say it is for our stump pain. And here you can write which drug you'll be using as a test dose for the before intrathecal implantation, how large the dose was, the pain in the relevant area before the test dose and after the test dose, and also the spasticity in the relevant area before and after the test bolus, as indicated by the modified Ashworth scale. That is the most complicated form, and let us say that for the rest of the demonstration we'll just take a follow-up visit that would be for any kind of therapy. As I said, first of all you choose the work status. Let's say this patient is partially fit for work, and you choose here on a work status where the patient is in the social system, is employed, self-employed. Furthermore, you can also choose pensioner, unemployed benefit, and so forth. In this case, let us say the patient is in flexi job or has light duties, and here you can write how many hours per week this patient is actually working. Then, as you will see, for each indication that you already noted for this patient in the clinical data, you'd have the questions relating to this. So in this case, you would be asking, so what is your average pain score for the last 7 days and your worst pain score for the last 7 days in your stump pain in your right side in your forearm. And let us say the average pain score is 7 and the worst pain score is 10. And then again here, because we have also entered phantom pain for this patient, you would be asking, so how bad is your, with exactly the same questions, how bad is your pain, your phantom pain in your right forearm? And let us say it is slightly worse, 6 on the average and 8 on the worst. Then here you can write whether the patient has been implanted or not. For the SCS status, in this case, if the patient is not yet implanted, would be for a preoperative visit, you can simply choose what the patient's overall expectation for the outcome of SCS is, from very much improved to very much worse, and that would be the same for each other therapy in the database, be it DRG, PNS, and so forth. If it is a follow-up visit, let's say that the patient is using it intermittently, it is not the evaluation, it's not the expectation, but the evaluation of the treatment outcome, let us say, is much improved, hopefully. You can rate the physician-rated outcome will be, in this case, satisfied. The patient would probably choose SCS again, and the patient would probably also, in this case, recommend SCS to his or her peers. And as always, if you're in doubt about the meaning of the question, there is the little help bubble right next to the drop-down menu. You can write any notes here in free text, and you press save, and the form gets registered and will show up on the timeline, so you can always return to it just by clicking.